Also tonight, we are learning more information about another COVID variant gaining attention around the globe. It is now being referred to as Delta. It started in India. It is estimated to be 40% more transmissible than the original strain of COVID. Today, Dr. Anthony Fauci warned Delta is rapidly emerging as the dominant variant in the UK, and it cannot be allowed to happen in the U.S.
The transmission is peaking in the younger group of 12 to 20-year-olds, namely that group that we're concerned about here, about making sure they get vaccinated.
Dr. Fauci says Delta has been reported in 60 countries, including the U.S. And joining us tonight to talk more about this Delta variant is Dr. Amesh Adalja. He is a senior scholar at Johns Hopkins University Center for Health Security. Dr. Adalja, what concerns you the most about the Delta variant?
The biggest issue with the Delta variant is that when you get vaccinated, both doses are necessary of the mRNA vaccines to give you protection against the Delta variant. So we have many people who have gotten first doses who may not have gotten second doses yet. That's where the Delta variant gains a foothold. The vaccines are the solution to the Delta variant, but it's the case that we have to get full vaccination in order to be the most resilient to it.
Which vaccine works better against this one?
Right now, we have data on the mRNA vaccine. So that's both the Pfizer and the Moderna vaccines. That's where we really see the data that shows that they are robust against the variant, especially when it comes to what matters: serious disease, hospitalization, and death.
And you heard Dr. Fauci there say that it is more transmissible, more hospitalizations in that younger age group, 12 to 20 or so. Why is that? What's different about this variant?
Well, in this age group, you don't have necessarily the level of vaccination that you do in, for example, people that are above 65. You also have that age group being spared from the severe consequences of disease, so they're more likely to be out and about even when they're not vaccinated. So I think it's more a factor that people in that group are not highly vaccinated and they're more risk tolerant. So that's where this variant is infecting them.
Given the fact that we're seeing this spread so much in India, the UK, and so many other countries, should we be doing things differently here in the U.S. to prepare for the spread of the Delta variant here?
The best way to prepare for the spread of the Delta variant is to get vaccination rates as high as possible, especially in those individuals who are at high risk. But I think it's also important that now that we have eligibility in the age group 12 and above, that we really make it easy for people to get vaccinated, that we really encourage people to get vaccinated, because that's the way we keep resilient to these variants, is by having the highest level of vaccination, because that denies the ability of the virus to cause serious disease, hospitalization, and death. And that's been the whole purpose of the vaccine program from the beginning.
I hear what you're saying, but before I let you go, there are a lot of people who are not getting the vaccine. We're seeing health and safety restrictions being lifted across the country. So should we be continuing to wear masks? Have we opened things up too soon?
If you're somebody that's fully vaccinated, the virus no longer poses a threat to you, and you don't pose a threat to other people. So I do think that we have the ability to start to open things up for vaccinated people. If you're unvaccinated, I think you still have to be cautious. You still have to think about wearing a mask when you're in crowded scenarios where you can't social distance. But what we've done is vaccinate about 75% of those people who are above the age of 65, and that's who made up the bulk of the hospitalization. So we're in a different place with this pandemic versus other countries, because our high-risk population is so protected that we're unlikely to see hospitals go into crisis the way they did in the spring of 2020.
Let the vaccine do its work. Dr. Amesh Adalja, appreciate your time as always. Thank you.
Thank you.